Ms. Ross from North Carolina for 5 minutes of questions.
Thank you, Mr. Chairman. I want to thank you, Dr. Fauci, for your voluntary testimony today, also for so much grace in your 14 hours of testimony. And I, again, want to thank you for your service and your patience. It's truly remarkable. Because it bears repeating, let me just remind everyone that after 15 months, my Republican colleagues' extreme allegations against you remain unsubstantiated. Unsubstantiated. And now, during your two-day closed-door interview in January, you discussed a number of topics regarding the public health response to the COVID-19 pandemic, some of which we've touched on briefly, but I just want to dive in a little bit deeper here. For example, you discussed both then and here with Congresswoman Castor the recommendation that we maintain 6 feet of distance between one another to reduce the spread of COVID-19. And you discussed how social distancing recommendations were developed, that you yourself didn't pick this 6 feet, and it was just really kind of a guideline in the moment. In your view, though, do social distancing recommendations and other public health measures to reduce transmission save lives?
Definitely.
Okay. I'd also like to go back and take a deeper dive into the COVID-19 vaccine discussion that we just had. And you were also asked about that during your interview in January. In the Select Subcommittee, we've heard suggestions that the vaccine was ineffective because of breakthrough infections that occur after vaccination. We just heard about that right here. But as I understand it, perhaps the strongest measure of COVID-19 vaccines' effectiveness is the reduction of severe disease and death, not necessarily getting a milder form of COVID. Could you talk about that a little bit?
Yes, it's very clear that when you're dealing with many vaccines, but particularly when you're looking at COVID, as I mentioned, and I'll repeat it quickly for you, that early on there was a degree, not as much as against severe disease, of protection against infection. Unfortunately, that protection against infection, which is related to transmissibility, waned rather rapidly in a matter of months. What has stood firm, well, much better than transmission, and much better than infection, is the ability to prevent someone from hospitalizations and deaths. And in fact, the curves, Congresswoman, are stunning. When you look at the deaths and hospitalizations of people who are unvaccinated, it's like this. When you look at the deaths and hospitalizations for people who are vaccinated and boosted, it's like this. The difference is profound. When you're dealing with infection, again, less so, because of the waning of protection against infection.
Well, and that was also confirmed by a Commonwealth Fund December 2022 report that which came out 2 years after the Biden administration's effort to get COVID-19 vaccines in arms, and your effort too, that it prevented more than 3 million deaths and averted 18 million hospitalizations. And that came out in 2002, but it seems to corroborate what you're saying.
Indeed, and $1.15 trillion in healthcare costs.
Thank you for that add. One pillar of the vaccine requirements was to have an increased uptake in the COVID-19 vaccines. And that at the time was supported by leading physicians, including the American Medical Association, the American Academy of Family Physicians, the American Academy of Pediatrics, and more. Were the vaccine requirements a clinically sound tool for improving uptake of a safe and effective vaccine?
Yes, you would like people to get vaccinated voluntarily and realizing the important effect on it. But the fact that people were vaccinated by whatever their motivation was clearly saved many, many lives.
And just with the 17 seconds I have, what steps can public health officials take to bolster confidence in these life-saving interventions since there has been so much misinformation circulating?
That's going to be very difficult, Congresswoman, because there is so much mis and disinformation around that we've got to do a better job of reaching out and trying to get the correct information. But that's difficult when you have a very energetic group of people continually spreading mis and disinformation about vaccines. We've got to be more proactive in putting out the facts and the data and the information that's correct.
Thank you very much for your testimony, and I yield back.